We've come a long one. Thank you so much for sticking in here on One-on-One with Amon. Many more subscribers have been joining in. They've been hitting the bell, and we are so much happy about that. Thank you for sticking with us. Thank you for telling your friends to come and subscribe. We began with that first video of ours, which was what is in the package. Then after that, we brought in our menu, and then after that, last week we're talking about getting started, what you need to do to have a successful interaction, what you need to do before, what you need to do during, and what you need to do after. Remember, this week I had promised, and when we promise, we do not disappoint, and promise that we will be talking about our sexual reproductive body. The content we are sharing today is not for children who are below the age of 13, and parental guidance is strictly advisable. So thank you so much. This session for today is talking about our sexual reproductive body, and our major concern will be basically looking at two major areas of our sexual reproductive bodies. And we'll be looking at the male, we'll be looking at the female sexual reproductive bodies or sexual reproductive organ, what they are. The question I've been asking you people is that, do you understand your sexual reproductive body? We're going to be looking at what these organs are, the different parts, and what their functions are. And we'll be asking ourselves that, what will happen if you do not take good care of your sexual reproductive body? What are the different risks that are associated with your failure to take care of your sexual reproductive body? Without wasting any much time, fast forward. One of the first parts or the first issues we're going to be looking at in our sexual reproductive body is the male sexual and reproductive organs. And this one you're going to be looking at the external view of what is known in English as the penis. People call it the penis, people call it the what, but me, I would pronounce it as penis. And we're going first of all to be looking at the external view of a penis. Young man, big man, do you know how your reproductive organ called the penis looks like? Here, we'll be taking a lot of concern about only three parts. Now, the penis, we are saying that a penis is a member of the urinary and reproductive function, and it is a very sensitive organ, the size of which varies from man to man, and most time the penis remains soft and flabby. People would say flaccid, but when the tissue of the corpus spongiosum fills up with blood during sexual excitement, it increases in volume and becomes hard, a process which is called an erection. A number of us men have gone through that, a number of older men, a number of young men have gone through that, and we are saying that during this, during sexual intercourse, when the penis is hard and it has been filled with blood, when highly stimulated, it releases a liquid called sperm or semen, which contains spermatozoa. And now remember that this spermatozoa, as we shall be seeing as we go on, is responsible in a way for making an Amon, who is here for making you who subscribe to One-on-One with Amon Mliwa. And the ejaculation of the sperm produces an intense feeling of pleasure called an orgasm. So, young man, one of the parts that we're looking at as part of our sexual reproductive body is the penis. So if you're a man out there, we've just told you briefly about what the penis is. Now, we'll be looking at a number of parts, external parts of the penis, and one of them is what we call the scrotum or the scrotum. Depending on wherever you come from, the pronunciation doesn't matter, the body part is the same. So the scrotum is a type of sac, and this type of sac is behind the penis, which has various layers. The external one is a fine skin covered with hair, with a darker coloring than the rest of the body, and its appearance varies according to the state of contraction or relaxation of the musculature. In cold weathers, for example, now my men there will know, will remember, I just want you to remember, has this happened to you before? In cold weathers, for example, the scrotum becomes more contracted and wrinkled, and in hot weathers, it becomes smoother and elongated. Why? It's because there is a particular temperature at which what is contained in the scrotum, which we are going to be looking at as part of the external parts of the male reproductive system, the testes and the testicles, they're supposed to be kept at a particular temperature. So we're saying that In cold weather, for example, it becomes more contracted and wrinkled, and heat. In heat, it becomes smoother and elongated. The scrotum contains, as I earlier said, what we call the testicles. So, one of the body parts of the male reproductive body that we're looking at is the penis. And the penis, one of the parts we have just talked about, is what we call the scrotum. What about the other? The other part that a number of us or people need to know about is what we call the prepuce, or the foreskin. The foreskin. And we're saying that this is the skin that covers the head of the penis. And when the penis becomes erect, the prepuce is pulled back, leaving the glands. Now, the glands is another part that we are going to look at. And this glands, where it comes from locally in Uganda, is called the head. You see, leaving the glands or the head of the penis uncovered. And when this does not occur, the condition is called phimosis, which can cause pain during sexual intercourse and hampers personal hygiene. Phimosis is easily corrected, however, through surgical intervention using a local anesthetic. In some cultures or countries, or in some families, the foreskin of the boy is removed in a procedure called circumcision. Now, the foreskin, I just want to take some time to talk about the foreskin, because the foreskin, you've heard that circumcision reduces risk of HIV infection by up to 60%. Why? One of the reasons is that the foreskin, if you're watching my sleeve of the shirt, let's imagine this is the foreskin. My sleeve of the shirt is the foreskin. So in the foreskin here, it harbors a number of cells which are called target cells. Now these target cells are very prone to HIV. They are very prone to HIV. So that's the reason they say that if you are circumcised, because you can imagine, when you're going to have intercourse, it pulls back, just like my sleeve of the shirt is pulling back, and then you have your sex. You have your sex, the target cells are around here, so the HIV gets there, and then after the sexual intercourse, the foreskin goes back. The prepuce is actually harboring. It's a very good habitat for HIV. So it's one of the reasons they say that when you remove it, it means you've removed the habitat for the target cells, and you're actually putting yourself lesser at risk of getting the HIV as a result of getting in contact with the target skills. Ladies and gentlemen, you're still watching One-on-One with Amon Muriowa, your online YouTube learning channel. Remember, today's content is PG, rated PG-13, and children below the age of 13 are not recommended to be watching what we're talking about. So, young man, older man, what we're talking about is the male reproductive organ, the external view. We've talked about, it's called the penis. We've talked about the scrotum, which is a sac that houses the testicles. We've talked about the prepuce, or the foreskin, which covers the head of the penis. And that head is called glands. So the other part we're looking at is called the glands. And as we say, that the glands is the head of the penis. And the skin is very soft. The skin of the glands is very soft and very sensitive. That's the reason if a person is going to have sex, or they are getting sexcited. Now that's not an English word. Me, I'm calling it sexcited, excited for sex. They'll keep touching it, and it's very sensitive. When you go back, I want you to write back to me and tell me what you remember that we've talked about the male external organ, the penis. Of course, there are other parts about the male organ, the penis. We've talked about the scrotum, we've talked about the glands, we've talked about the prepuce. There's another. Between the glands and the scrotum, there's that part. You can imagine if this was the glands, the scrotum is down here, there's this part, which we call the shaft. Of course, the shaft is that bit that holds tissue, and that is the tissue that becomes, for lack of a better word, harder in the due course of sexual intercourse, or when someone has gotten aroused. You're still watching One-on-One with Amon Muriowa, your online YouTube education YouTube channel. So, still on the male reproductive organ, that's the external bit, the external genitalia of the male reproductive organ. What about the internal ones? Now, in the internal, we're going to be looking at a number of areas. We talked about the testicles, and we say that the testicles are the male sexual glands, whose function is to produce hormones and spermatozoa. So the testicles produce the hormones, they produce the spermatozoa. One of the hormones produced is called testosterone, responsible for male secondary characteristics such as skin tone, facial hair, tone of the voice, and muscles. So characteristics, the male characteristics like change of the voice. Probably when I was young, I wasn't talking like this. I would call my father and say, "Hi, Baba, how are you?" But now my voice is bigger, and that is all the function of testosterone. The beards that I shave twice every week is a result of the testosterone, and the other biological features that change as a result of that hormone that is called testosterone. And we are saying that they have the form of two eggs. Now these are the testicles. They have the form of two eggs. If you've eaten egg, chicken egg, any bad eggs, they're like two eggs. And I'm saying that to fill them, one only has to palpate the scrotum pouch. So if this is the scrotum pouch, someone will need to fill them. And this is a very important function. Even at birth, when a child is born, a male is born, the medics will look for the two testicles. If one is not there, they'll make sure it gets down, because it's not supposed to be there. A man is supposed to have the two testicles. If there's a medical issue, then that one should be addressed ASAP. So one other area about the internal genitalia of the male reproductive organ or system is something we call the urethra. And a urethra is a tube used both for urination and for ejaculation. Now we'll be talking about the female genitalia, and you realize that unlike women, men only have one tube for urination, and it is the same tube through which the spermatozoa or the semen pass during ejaculation. The other part of the internal genitalia of the male reproductive system is called what we call epididymis, and it's a canal connected to the testicles, and the spermatozoa are produced in the testicles and stored in the epididymis until they mature and expelled at the moment of ejaculation. So we had our testicles, we talked about. The testicles produce the spermatozoa, as we said, and they are stored in the epididymis before they mature and expelled at the moment of ejaculation. We should not forget another part of the internal male genitalia, which is called the seminal vesicle. Now when we talk about seminal vesicle, someone is still thinking about semen, and someone is talking about a vessel through which the semen, or that stores the semen. So the seminal vesicle, these are basically two pouches that provide the fluid for the spermatozoa to swim in. Because remember, the spermatozoa itself is very idle and very weak to move the distance of coming from the testicles through the penis into the woman's female genitalia called the vagina. But this fluid, which is called the semen, pushes the spermatozoa at that speed, young man, older man, you know what I'm talking about, into where they are supposed to be. So this semen is actually stored in that pouch, in those two pouches, which are called the seminal vesicle. So another part of our importance today is what we call the deferens ducts, or it's called vas deferens now. Sometime back, I was involved in a vasectomy campaign, and these were ducts that were so much importance to me. So these are two very fine ducts of the testes which carry the spermatozoa to the prostate. And these two ducts there, as you're saying in the picture, the vas deferens, there are two of them. And they are very, 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 very important when we come to the act of transporting basically the spermatozoa. One last one that I'll be talking about here on the male reproductive genitalia is what we call the ejaculatory duct, and is formed by the junction of the different duct and the seminal vesicle. It is short and straight, and almost the whole trajectory is located at the side of the prostate, terminating at the urethra. In the ejaculatory duct, fluids from the seminal vesicle and the different duct mix together and flow into the prostatic urethra. Ladies and gentlemen, I've always reminded you, you're still watching One-on-One with Amon Muliowa, your online educative channel. If you have any questions on this, remember to drop the questions in the comments box, or you can drop the questions on my Twitter handle at Amon Muliowa. Our last view will be a discussion about the female sexual reproductive body, the external view, mons pubis. Now, mons pubis here is that part, as we're saying, that the rounded protuberance located on the pelvic bone called the pubis. In an adult woman, it is covered with the hair which protects the region. There's that part above, just before your waist, and before the reproductive organ itself, which has usually pubic hair on it, is what we are calling mons pubis. Then there's another part we're calling labia majora, which is covered with sparse hair, and it's the most external parts of the vulva. They commence at the mons veneris and run to the perineum. Now, in your picture, if you can get back to the picture, you can see the labia majora. It's called labia majus, that part there. As this person has said, covered with sparse hair, the most external parts of the vulva. And they commence at the mons veneris and runs to the perineum. When you talk about the labia minora or majora, you do not have to forget to talk about the labia minora, which is a pair of skin folds with no hair. They can be seen when the labia majora are parted with the fingers, and they are very sensitive and increase in size during excitation. Very important part here is the clitoris, and the clitoris is saying that it's a rounded organ. Very small but very extremely important for the sexual pleasure of the woman. It is very sensitive, and when a woman is not excited, touching it directly can be unpleasant. But when gently stimulated, the woman experiences an intense and pleasurable sensation called an orgasm. So these are body parts, and people need to know what is the use of all these ones. For example, someone has just wanted to know what is the importance of the clitoris. The other one is what we are calling the opening of the urethra. And the opening of the urethra, it is the opening where the urine comes out. Now remember, when you're talking about the men, we say that for the men, actually we have one opening for the urine and have one opening for the ejaculation. But for the women, now you're seeing that their urine actually comes out through the urethra. The other part is what we call the opening of the vagina, the elongated opening where discharge, menstrual blood, and the baby comes out. Can you imagine that? So for the women, their urine comes out through another area, and the baby and their baby and the menstrual blood comes out from another area. For the men, urine and they ejaculate through one area. And that is what we talked about. You're still watching One-on-One with Amon Muliowa, your online education channel. Now, after talking about the external genitalia, female genitalia, why don't we get into the internal female genitalia? A number of parts here. I can see on your screen a number of parts: the egg, sometimes called the ova, the fallopian tubes, the uterine cavity, the endometrium, the myometrium, the vagina, the cervix, the uterus, the ovary. Quick, as we go ahead, one of the parts we are going to start with looking at here is what we call the uterus. The uterus. Ladies out there, we've talked about my uterus, you need a uterus, but what is the uterus? So we're saying that it is the organ where the fetus develops during pregnancy. You and I developed in the uterus, unless you're a child, unless you are a test tube baby during pregnancy. So when a woman is not pregnant, her uterus is the size of a fist. I've always told my women in the community where I go to talk to them that your uterus might be the size of your fist. That is the reason, as the baby grows, for lack of a better word, the tummy grows bigger. It grows bigger because the fist is actually adjusting to the size of the baby. It's interesting. The other one that we need to take note of is what we call the cervix. It's called the lower part of the uterus. It has an orifice or an opening where the menstrual fluids pass and where the spermatozoa enter. Now, we talked about the spermatozoa with the men. So, the men's spermatozoa come in from wherever they are coming in, and they are saying that the lower part of the uterus called the cervix, it has an opening, an orifice where the menstrual blood pass and where the spermatozoa enter. And they're saying that in a normal delivery, this orifice increases or dilates to allow the passage of the infant. The body of the uterus, the main part of the uterus, it is the main part of the uterus which increases in size during pregnancy and returns to normal size after the birth. It consists of two external layers, a membrane called the peritoneum and a muscular tissue called the myometrium. The mucous membrane that lines the uterus is called the endometrium, which loosens and sloughs off during menstruation and is renewed monthly. A quick one. For my female friends out there, the blood that comes out of you during menstruation is not a broken egg. I've always given an analogy that in Africa, when you're preparing for a visitor, you do everything. You clean the compound, you cook good food, you do good everything. You buy new clothes because you're expecting a visitor. But when a visitor does not come, you get annoyed. So even this is what happens with the uterus. Every month it expects a visitor, and that visitor is a pregnancy. When the pregnancy does not come out, everything is pushed out. The uterus gets annoyed. And in one of the languages in Uganda, central Uganda, they say that the uterus has cried. Nabana yakabye. So it is that the lining of the endometrium. And we are told that the thicker the lining of the endometrium, the thicker might be your flow during menstruation. You're still watching One-on-One with Amon Mio, your online education e-learning channel. One of the other parts we've talked about the uterus, we've talked about the cervix, we've talked about the body of the uterus, we are going to talk about the fallopian tubes, and these are two. One on either side of the uterus where they join the ovary. They open out like a flower, just as you're seeing in the picture. Through the tubes, the ova or the egg cells pass to the uterus. Exactly. So here we have the ovary. We have the ovary. And the ovary to make the ova, the eggs, you see? And the egg passes through here like this. You see? That's what I'm talking about. And here we have the fundus. If my head could be called the fundus down there. So that's what we are looking at as the internal female genitalia. Thank you so much for watching. So the other one, of course, as we're saying, are the ovaries, and these are two, the size of the large olive, basically one on either side of the uterus, attached to it by a nerve ligament and a layer of skin. And they're saying that the ovaries, basically, their duty is to make amaji, the eggs, which eggs are responsible for reproduction when they get in contact with a man's spermatozoa. The last one here, ladies and gentlemen, is what we call the vagina. Now, it is the canal which starts at the vulva and runs to the cervix. As you're watching that picture. Inside it is made of tissue similar to the inside part of the mouth, with various folds that allow it to stretch during sexual intercourse or to allow passage at childbirth. And they're saying that some women feel pleasure during penetration of the penis in the vagina, others less. For most women, however, stimulation of the clitoris provides greater pleasure than stimulation of the vagina. Ladies and gentlemen, what is the importance of knowing your body parts? Why must you know about the clitoris? Why must you know about the vagina? Why must you know about the lining of the uterus? Why must you know about the glands? Why must you know about the prepuce? Why must you know about the scrotum? Why must you know about the vas deferens? Why must you know about all these parts? The answer is one. When one knows, they are able to devise means of preventing an SRHR risk. When you know, you know. When you do not know, you do not know. So we are saying that, for example, what are some of the risks that are associated with these organs? The reproductive, like the female reproductive organ. What are SRH risks? We are talking about sexually transmitted infections. If you do not know how to take good care of them, you'll get sexually transmitted infections. And these are infections that we're going to be looking at here, right here on this channel. Like syphilis, gonorrhea, chancroid, a number of them. We'll be talking about them here. What are the other things, the risks that are associated with you not knowing your body? Unplanned and unwanted pregnancies, cancer of the cervix. We're talking about prostate cancer, pelvic inflammatory disease, cancer of the penis. We're talking about side effects from contraceptive. We're talking about barrenness. We're talking about unsafe abortions. We're talking about erectile dysfunctions. So, what does someone need to do to manage this? One of the things is make the right decisions. And making the right decisions will include regular medical checkup, avoiding concurrent multiple sexual partners, voluntary medical male circumcision, ensure proper hygiene, contraception, and post-abortion care. Ladies and gentlemen, thank you so much for spending your time with me. Thank you so much for subscribing. Thank you so much for telling your friends to subscribe. I want to promise you that we will do whatever we can to make sure that we bring you the content that you deserve. If there is any question that you want to be answered here, please do not mind. Just go hit the comment section, drop the comment there. If there is anything that you want a further explanation on, please, you can follow me on my Twitter handle at Amon Muriowa. We love you so much and see you next Wednesday.